The etiology of Alzheimer's disease is believed to involve environmental exposure and genetic susceptibility. Large amounts of literatures have been published to investigate potentially modifiable risk factors for this disease. However, these studies failed to get consistent results, which confused our knowledge about this field. Our study was to roundly evaluate the association between Alzheimer's disease and its modifiable risk factors in a meta-analysis way. PubMed and the Cochrane database of systematic reviews were systematically searched from inception to July 2014, and references of retrieved relevant articles were further checked. Both prospective cohort studies and retrospective case control studies were included. We defined 4 evidence grades, including grade 1, 2A, 2B, and 3, according to pooled sample size and analysis heterogeneity. A total of 16,906 articles were identified, of which 323 papers with 93 factors met the inclusion criteria for the present meta-analysis. Theses factors were further categorized into 7 groups, including pre-existing disease, biochemical exposures in serum or plasma, dietary exposures, medical exposures, lifestyle, occupational exposures and psychological conditions. Among factors with relatively larger pooled sample size, we found grade 1 evidence for 4 medical exposures, including estrogen, statin, anti-hypertensive medications and NSAIDs, therapy, as well as 4 dietary exposures including folate, vitamin E, vitamin C and coffee as protective factors of Alzheimer's disease. We found grade 1 evidence indicating hyperhomocysteine and depression as significant risk factors for developing Alzheimer's disease. Complex roles of pre-existing disease and lifestyle in influencing Alzheimer's disease risk were also revealed. For pre-existing disease, frailty, carotid atherosclerosis, hypertension, low diastolic blood pressure, diabetes mellitus type 2 in Asian population will promote the risk, whereas a history of arthritis, heart disease, metabolic syndrome and cancer will lower the risk. For lifestyle, low education, high body mass index in midlife and low body mass index will increase the risk, whereas cognitive activity, current smoking in Western population, light to moderate drinking, stress, and high body mass index in late life will decrease the risk of the disease. On the other hand, we found no association of Alzheimer's disease with 23 factors, including 19 with grade 1 evidence and 4 with grade 2A evidence. This is the first comprehensive systematic review and meta-analysis, which takes into account almost all risk factors suitable to be intervened via personal, clinical, and public strategy. This study emphasized the heterogeneity of modifiable risk factors of this most common type PF dementia and the complexity of its non-genetic etiology. Our study indicated that the effective interventions in diet, medications, biochemical exposures, psychological condition, pre-existing disease, and lifestyle may be promising options for preventative strategies. Of course, further good quality cohort studies and randomized controlled trials targeting these elements are necessary.